Hello, everyone. I am excited to be back with you today. Let's get into a whole bunch more questions. Before I do that, I wanted to give you an update on the book. I did get the final manuscript turned in this week. That was a huge reward. And it's kind of funny. I have a good friend, Irene, who she tells me all the time. She said, you move so quickly. You need to give yourself a chance to celebrate a little bit in between all the things you do. And so I decided I do need to do that. I do need to celebrate. And so I've decided what I like to do to celebrate. I buy myself a new international cookbook. So I bought myself a new international cookbook to celebrate getting the manuscript turned in. I figure for the $28 or whatever, it's actually cheaper than going out most of the time. Anyway, it's just kind of a fun little thing that I do. So excited to get the manuscript turned in. And now I'm really excited to share with you all about what the book is about. And there's so many connections here. So let me tell you a very personal example on how this works. So when I got back from Cambodia, ever since then, I've just struggled to stay completely well. And I didn't know why. And I thought, most likely I got some sort of parasite there. We actually had one of our youth that was on the trip with us that got very, very ill. He got a parasite that was the dysentery parasite. So he got dysentery while we were in Cambodia. He was very sick. Got him on medication. He got much better by the time we were leaving. But I thought, I wonder what parasite I've come home with. And I got just a 24-hour bug last weekend, and it turned into like 4 days of no eating. And I couldn't figure out, why is this so much worse for me? And I think it's pretty much because that bug then had a frat party down below with the other bugs that I brought home from Cambodia. And anyway, I was feeling very frustrated. And I thought, okay, no, I know how to do this. So let me walk you through what the Living Well with Dr. Michelle framework, it's called the Cell Well framework, what that looks like. Let me walk you through that. So here I am. I'm struggling. My gut's not feeling good. I'm not eating very well. And I can tell that I probably have a parasite of some variety. So there's 4 things that every cell needs. Every cell in our body needs one or more of these, or needs all of these 4 things, but it might be in need of one of these things. So one is supplies, one is support, another is security, and the 4th is signaling. So you're going to be hearing a lot about these 4. And as I thought about it, I thought, I need security. My defenses we need to kill whatever bugs are going on in my system right now. So I started thinking about that, and it made it so much simpler to think about this. I thought, okay, security. What do I need to do to defend my body from parasites? And then number 2, I think about, okay, what are my symptoms? They're largely gut related. Well, the gut is a summer organ, summer season organ. We're going to talk a lot about seasons, the summer season organ. So that means a lot of foods that have to do with that. So we have to do tomatoes, and we do things that are hot, like clove. You don't think about clove as something that's hot, but clove is a great one. So I started thinking, what can I add? So I started adding clove. I started adding something called wormwood that's going to kill the bugs. I found kind of a combined tincture that had a whole bunch of other herbs in it, like black walnut hull, all these things that are going to defend my cells against the parasites. So it simplified it down. I'm just doing one thing right now. I'm just defending. I'm not doing anything else, just defending. And it's been pretty miraculous, actually, the change I've seen just in this little short time and really taking this focus. So I'm going to walk you through all of these steps. There's going to be an assessment, or there is an assessment, I'll be sharing it soon, where you can figure out from your symptoms which season you're currently in. And your symptoms help drive where you then start. So let's say that you have an issue with your liver. Well, and how do you even know that you have, an issue with your liver? Well, you're going to sometimes you have pain right here underneath your right rib. That's where the liver lives. But you also just might have kind of indigestion. Things just don't digest very well. You don't feel super great. Those are all liver issues. Well, if that's the case, that's a spring problem. That's in spring. So what do you do for that? You use all sorts of greens. Things are going to be active in springtime. So you're going to do a lot of detoxing. You're not going to do heavy foods. You're not going to do things with fats. You're not going to do heavy starchy carbohydrates. You're going to eat a lot of greens because they help to detox the body. So again, it's all based on what are your symptoms, which season does that relate to, and then what are you going to do? So let's say my liver is struggling. I need liver support. What's going to support my liver? Well, it's going to be things that are going to help to detox it and to support it during that detox process. Probably some real simple carbohydrates, so some fruits, things like that, along with greens and lettuces and salads. It just makes sense when it makes sense. So I'm going to help it to make sense. So these are all things that I'm going to be sharing and we're going to be working through. All right. I see somebody's trying to put something on here, but I don't have a question yet from Sandy. So Sandy, keep trying. Let's see if we can get that. Let's see if we can get that out. All right. I'm going to start to to go through some questions. Okay, can you tell me if this mouthwash will kill nitrates needed to create nitrous oxide? So that's an interesting question. So there's studies that show that nitrous oxide is created sometimes on the back of the tongue, and I think that's probably what you're talking about. You actually can't kill nitrates, but you can kill bacteria that can form nitrous oxide. So will it kill that? Does it also affect that? Another place that nitrous oxide is, it's actually nitric oxide, is formed is the nose. So no, the mouthwash will not do it because the mouthwash is colloidal silver based, and colloidal silver is a selective killer. So what it means is it's going to kill the bad bugs and it's going to leave the good bugs, the healthy bugs alone. And the healthy bugs are the ones that help create nitric oxide. So you don't want alcohol. You don't want something that's going to kill every bug in your mouth in any kind of a mouthwash. And this is why there's a lot of people poo-pooing mouthwashes. They're saying, no, you should never use it. Well, yes, you can use it, but you need to be conscious about it. No alcohol. That's the problem. Would you recommend, and why do we want nitric oxide? Why do we even want that? Well, nitric oxide does a couple of things. It dilates your blood vessels, which is going to be very important for heart health. If you have high blood pressure, if you even sometimes have high cholesterol, which is due to constriction and other things in the arteries, if you have that, nitric oxide is your friend. You need more of it. So you want your body to be able to create more. So that's one thing that we're very conscious of with the mouthwash for sure. What would you recommend for mouth breathing for a 14-year-old besides a mouth guard? I understand it's easier to treat and revise when younger. Would love to hear your thoughts. All right, this is huge. Okay, first of all, let's talk about why is mouth breathing a problem? Well, there's a few issues. First of all, when you're breathing through your nose, the nose is passing through the turbinates, which are kind of these curly Q things right here in the nose, and it's humidifying the air. I actually had a great meeting with an ENT this week, and she shared a lot with me about what the nose does. So when you're breathing through the nose, you're humidifying the air. You're also filtering the air. I joke with kids all the time. That's what snot is, basically, right? It's the stuff that you don't want to get into your lungs that your nose is able to filter out. So it filters the air, it humidifies the air, it warms the air, it does all sorts of things for the air. But also when that air passes through the nose, it creates that nitric oxide that we just talked about, which helps to open your blood vessels, which helps to create growth hormone. It does a lot of really great things. So that's like physically what the air actually going through the nose, what it's going to do to the air. But structurally, there's a lot of things that go on as well. So when you're mouth breathing, first of all, you're not being able to humidify that air. So you get hot, dry, dirty air hitting the back of your throat. You're going to get kind of that swollen or just kind of sore back of your throat. You're going to get swollen tonsils. You're going to get all kinds of things because you have all this air that you didn't properly filter through the nose first before you breathed it. But then just the act of mouth breathing, what you're doing is you're opening your mouth. Opening your mouth creates long and lean facial structures. Long and lean facial structures, you might think, well, I want that, right? No, you don't, because too narrow here creates not enough room for the tongue. So then the tongue ends up kind of falling forward. And you see these kids where they're biting their tongues like this all the time when they're playing sports, when they're playing video games, when they're focusing on schoolwork. Why are they biting their tongue? Because the tongue doesn't have room in the back and it's falling back where the air needs to pass. So they have to hold it forward to be able to get it out of the way to focus. So you often will see this when they're focusing. All of these are signs that they are not getting enough air to actually have their brain and their body operate properly. So if your 14-year-old is mouth breathing, a mouth guard is actually going to do almost nothing for them. All it's going to do is put more in the mouth. But we just talked about the problem is that there's not room in the mouth for the tongue, for the tissue, for everything else. So the mouth has to drop open to try to get air past all of that. The key is we have to make room for all of that. We have to make room for all of that. We have to make room for air to get through the nose. Here's the interesting thing. The bottom of the nose and the roof of the mouth are the same bone. Okay. So it's the same bone here. That's the bottom of your nose and the roof of the mouth. It's called the maxilla. It's the same bone. So if it's narrow inside of the mouth and there's not room in the mouth for the tongue, for all the tissue that has to fit, then it's narrow inside the nose too. There's not room for air to get by. So what we want to do is we want to make more space inside of the mouth for all of these tissues. We want to make more space inside of the nose. And the great thing on a 14-year-old is we have all sorts of things we can do for this. So we want to do expansion. We don't want to do just crank it as fast as we can go expansion. Why? Because you're going to have rebound. You're going to actually have it come back and you're going to lose that expansion. This is why you get relapse, why people have to wear retainers forever, because it didn't properly grow the bone. It just split the bone. So we need to properly grow the bone, expand it the right way. And then now there's room for the tongue, the tissue. The nose is wider at the base of the nose. All of these things are wider. The mouth can close. And there's plenty of room to get air where it needs to go. That's the key. A mouth guard is actually making this worse because the mouth guard is actually occupying some of the space in the mouth. Remember, we just said there's not enough space in the mouth to begin with. So a mouth guard is problematic. No. We need to expand. We need to make more room. And here's the great news. And this is what I talked with an ENT about today. She said, well, what can we do in an adult? We can expand as well. We have 2 appliances that we use, both are removable appliances. And one of them, it's a little bit bulkier and it expands and it literally helps to grow the bone in the roof of the mouth. And in an adult at any age, we can do this. The other one, we're just kind of tipping the teeth out and making more space, which is absolutely doable too. It all depends on, can you breathe through your nose? If you can breathe through your nose, we can tip the teeth. If you can't breathe through your nose, we need to actually grow the bone so that you can start to breathe through your nose. We have so many solutions for this, so many solutions for breathing better, sleeping better, focusing better, all of these kinds of things, and it improves your health exponentially. Okay, I'd like to know what season is causing the tip of my tongue is tingling. Okay, tip of tongue tingling. So the tip of the tongue is the heart. If you'll look online, you're going to see a tongue map. There's tongue maps. Just go look it up and you're going to see the tip of the tongue is the heart. So if the tip of the tongue is tingling, that means you're having some heart issues. That's a summer season. So in summer season, we're going to use warming foods. So you're going to use cayenne. You're going to use clove. You're going to use tomatoes. You're going to use things that are actually available in the summertime. You don't want a lot of heavy foods during the summertime. So you're going to use light foods, lots of veggies. But as that heart piece, you really want to focus on, do you have root canals right here on teeth on the sides? If you do, then it may be affecting your heart and the way that heart is actually working. You also may not be getting enough air, which may cause your heart to be pumping too hard. So there's so many different little pieces to put together, but that is summer season, and that's the heart that's going on if you have tingling at the tip of your tongue. All right. I had a small cavity and my dentist didn't fill it. He put a crown on it. Is that normal practice? It's hard to tell. If it was just a small filling, then typically we just do or a small cavity, we typically just do a filling. But once a crown, always a crown, so you can't reverse it. The key in the future is just to say, could this be just a filling? Would that be adequate? And hopefully the answer is yes. I have TMJ. Just curious if a chiropractor would be the first person I would go to, or a dentist. Absolutely a dentist, because the problem with just treating TMJ with chiropractic work is typically TMJ issues. There's two potential problems. One is a muscle problem and one is an actual joint problem. Let me tell you a little bit of a way to tell which one you have. If you say, my TMJ, my jaws just hurt so much. Well, what I need to know is it muscle pain? So I want you to feel like right here, there's kind of a spot right here. You can see where my finger is. Oh, wrong side. You can see where my finger is right here. If you've got a knot, I actually do. If you have a knot in the muscle right there, that's called the deep masseter. If it's tender to push on right there. If you have sore temporalis muscle right here, this most likely is a muscle problem when it relates to the TMJ, to the TM joint. TMJ stands for temporomandibular joint. So we say I have TMJ. It's actually kind of funny because we all have TMJ. We all have 2 of them, one right here and one right here. That stands for temporomandibular joint. The real official name is TMD, temporomandibular disorder. That's a side note. But okay, so muscles. Push right here, sore. Yeah. Oh, yeah, sore. Push right here, sore. Definitely. Push right here. It's kind of called the sternocleidomastoid muscle. Is it tense and tight and, like a tight guitar string right here? Yeah. This is most likely a muscle problem. Now, open all the way and push in. When you open, you're going to find a depression right there, because what's happening is the ball of the jaw joint is moving forward and it's going to leave a space. You can see my finger falling into it like that. If you open all the way and push in and it hurts, that's most likely a joint problem, because what you're doing is you're actually pushing against the joint itself and saying, does that hurt? So you need to differentiate. Is this a joint problem or is this a muscle problem? All right. So that's the first question. Then, would we work with a chiropractor or a dentist? Well, I always start with a dentist. Why? Because we're going to take a scan and we're going to say, okay, is this actually a bone problem that we need to correct? Is this something we need to regenerate in this jaw itself? Or is this the teeth aren't fitting together correctly, or you're having to hold your mouth open to get enough air at night, or all these things, and it's fatiguing the muscles? And if so, you can go to a chiropractor and they're going to adjust things and move things. But then you're going to go have a poor night's sleep again. You're going to wake up sore again. And you're going to say, gosh, that chiropractor didn't work at all. Well, it's not that the chiropractor didn't work. It's that the root cause of the sore problem, of the sore jaw, didn't go away. You didn't correct it. You've got to correct the root cause first to be able to then have lasting symptom improvement. So that's the key. Take the cone beam CT scan, see what's really happening, have a dentist look and see what's really happening. We actually work alongside of the chiropractor. We have them do all sorts of adjustments while we are rebuilding and regenerating this joint, while we are leveling the bite so that the muscles can release, while we're helping to open the airway so you don't have to hold the mouth open to get air at night. All of these things we're working with a chiropractor, but it's in conjunction with, not instead of. My tooth cracked or split in half. What would I do with the other half? Only half came off. Well, if only half came off, hopefully if it's not killing you, that's going to be savable. You're definitely going to need a crown in that situation. What a crown does is just replaces the whole missing piece. So definitely talk to a dentist about that. Dr. Michelle, so happy to find you. Thank you for all the advice. Thank you. I'm so glad you're on here and listening. What appliance do I recommend for teens to expand? Okay, so in teens, it's easier than adults, but we still use sometimes the similar appliances. Sometimes we'll do a fixed, so literally just braces, regular old braces. We can do a lot of expansion with that. Sometimes we do need to do some palatal expansion. So there are expanders that are put in the roof of the mouth that will help to make that movement. Again, on a teenager, it's pretty simple. We're going to just be able to make some space. You mentioned quick expansion. Can you elaborate? How long can you quickly expand and then let bone grow over with time with the expander in? Okay, so these are all questions regarding this expansion, and they're good questions. There's something called an RPE. What that stands for is Rapid Palatal Expander. So what that's doing is, you probably have seen these before. They have a little keyhole. They're glued into the mouth. They have a little keyhole, and you use this little kind of metal key and you rotate it, and it opens this expander out. Well, what science has showed is that you need to do it slow enough that the bone can grow a little bit more, bone can grow a little bit more, bone can grow. So we just don't do the rapid part of it. We slow it down just a little bit and do it over months' time rather than over just like 2 months. We'll use 4 months, 6 months, sometimes if necessary. I don't love to do that, but if necessary, we do that. It depends on how much expansion we need to do. You can also use a Vivos appliance. That was the next question. What is this appliance called? So the removable one is called a Vivos appliance. That's for an older teenager. The younger ones, they actually have something called a Vivos guide or a myo brace, which are going to help guide the growth in younger children. And we can start as early as 3 years old, as soon as they'll put something in their mouth and leave it in there. So we can start that very, very quickly. That's the two versions. And we also will do something called Candid. It's like Invisalign, but it is a little different. And the focus of the clear braces are expansion. So those are the two ways we do it. One of the fronts is apparently dead and getting discolored. What is the best option? Okay, I'm guessing you're talking about a tooth. The front tooth is discolored and discoloring. What is the best option? Best option is to find out, is it dead? Is it dead completely? And is it abscessed? If it's an abscess, then your two choices are only root canal and remove and replace the tooth. So that's the key. You need to find out, is the tooth abscessed or not? So cone beam CT scan will show you that one. My one and only filling fell out. A dentist I went to told me I need a root canal or implant. It isn't causing any pain, but they said ozone and crown would only be a 20% chance it would work. Okay, the key on this one is the tooth still alive? If the tooth is still alive, then ozone and crown, give it a try, see if it'll work. If it's not still alive, that is not an option anymore. You're only looking at root canal or removing and replacing. This is a pretty clear-cut line in the sand. If it's still alive, ozone and try to save it. If it's dead, root canal or remove and replace. And I prefer the remove and replace. No root canals, but I have one silver filling bottom right and the tooth is slightly cracked. The dentist wants to do a crown, which I don't want. Let's talk a little bit about crowns. And there's a lot of talk about, oh no, never have a crown. You don't have to have a crown. Well, I'll tell you that some of those dentists that are saying that are kind of stretching this information, stretching the truth a little bit, because there are other things that are very similar to a crown. The crown itself is not the enemy. What a crown is it's simply a complete covering. So it goes over the whole tooth like a hat, kind of like a top hat. And the purpose of it is to hold all of the pieces of that tooth together. Now, sometimes it's the only choice we have. If you have an old silver filling and it's cracked the tooth and you have 3 or 4 cracks going all different directions, well, I call that a time bomb tooth. You're going to bite on something hard and you're going to chip and break off half that tooth. It may break right into the nerve and you're going to lose the tooth. So a crown simply goes on and holds all those fractured pieces together and protects it. Now, there are some things called partial crowns, which instead of going all the way to the gum, it just sits like this, halfway down the tooth. They're my preference every single day of the week if we can do them. But it all depends on how much good tooth structure do you have left. I'm not going to leave a cracked piece of tooth. I'm not going to leave a decayed piece of tooth. Obviously, why would we leave any of that? So we need to cover over anything that's not strong enough to support itself. So we do onlays, what are called onlays. We prepare it similarly to a crown, but we just do the top half and not all the way down to the gum line. So it does save some tooth structure. A lot of time people are saying, they're doing very large fillings on these teeth. And I'm actually the dentist that gets to see a lot of these, because a lot of times people have gone to dentists that say, I don't do crowns because they like the philosophy, but then they come to me. I'm similar philosophy from a, natural dental standpoint, but I see that these huge, massive fillings, they don't hold up very well. And they're actually really difficult to do well, where there's no spaces that food's going to get caught, where the bite is actually really good against the tooth next, above it. There's just a lot of issues with giant fillings. I don't see that they're a good solution at all. So I prefer to do an onlay on a tooth like that, where it's like a partial crown. So ask if you can get an onlay instead of a crown. And I bet you they'll say, oh yeah, that's absolutely no problem. Okay, can I get braces if I have fillings on my front teeth? 100%. They're harder sometimes to stay on with those fillings, but 100%, absolutely. We do braces all the time with that. Is there a way to treat a cavity before having to get a filling? Also, optimal dental filling material in your opinion. So we've talked about this a lot. It's all dependent on the depth of the cavity. If the cavity goes through the enamel into the next layer down, which is called dentin, then most likely you're going to need to get it filled. If it's shallow and it's still in the enamel, that outer layer of the tooth, then absolutely, that's what my remineralization kit is all about. So you're going to use the tooth powder, the mouthwash, the vitamin D and vitamin K, vitamin DK, and the tooth and bone formula. And you're going to get minerals into the tooth from the outside of the tooth and from the inside. You're going to ingest them and get them from the inside as well. And you're going to see if you can remineralize the tooth. And you're going to give yourself, 3-4 months to see if you can do it. And if not, if the cavity still grows, then you're going to go back and get a filling done. Best filling material is going to be called composite. So it's a resin glass mixture, and that's what you're going to ask for as a dental composite. A friend lived in a house with well water, and first 2 children have chalky teeth. Then they moved to a home with fluoride, and third and fourth children teeth are beautiful. How can I explain? Most likely the well water had actually more fluoride. Well water often has fluoride in it, natural sources of fluoride in it, and then most likely it had more fluoride in it than what they had with the other water. Because if it's just treated water, you're going to have a measured amount of fluoride in the water. I don't agree with any of it, but that's what's in the water. In well water, often you have excessive amounts. And so that chalky white teeth, sometimes even blotchy with brown, that's called fluorosis. That's actually hyperfluoridation. That's what it looks like when there's too much fluoride. Do I know of a Chris Simmons DDS treatment for TMJ? I actually don't. So that'll be a good one for me to look up. What are your thoughts on tooth pillow? We actually refer to tooth pillow all the time. What tooth pillow is it's basically a conglomerate or a collaboration of dentists who do provide these Vivos guides. And they are for earlier intervention for younger children. And it can be done pretty much all virtually. So if you are living in a place that you don't have access locally to a dentist that can provide these guides to help to grow mouths and make more space in mouths for kiddos, then check out toothpillow.com, and they will be able to match you up with a dentist that you'll be able to work with virtually. Sometimes in your town, sometimes they actually have somebody local to you, or virtually if that's the best way. What do I think about tooth bonding? So tooth bonding, what that really is it's filling material on the outside of teeth, either to make it look better, to cover over a discolored spot, whatever it might be. And tooth bonding is just filling material. So if you get somebody who's skilled at it, it actually requires quite a bit of skill, aesthetic skill to make them look good. If you get somebody who's skilled at it, you can probably get 5 or 10 good years out of that. Why would it not last longer? Because that composite material, the filling material, actually picks up stain. So it will pick up stain over time, and you're just not going to love the way they look over time. But you typically can get 5 or 10 good years out of them if you go with somebody who really knows what they're doing. Can you reverse cavities? If so, how? Just talked about that. Absolutely. If they're in the outside enamel layer. Tooth powder, mouthwash on the outside, vitamin DK, tooth and bone formula on the inside. What is your opinion on commercial mouthwash? So it depends on the commercial mouthwash we're talking about. I don't like commercial mouthwash. So largely, that's why I have my own mouthwash, because I wanted to control the ingredients in that. Most commercial mouthwashes have high amounts of alcohol in them. Alcohol is going to cause numerous problems. It's going to kill the bugs in your mouth. It's going to kill the bugs in your gut, and it's going to dry your mouth out, which leads to more bad breath. So absolutely nothing with alcohol ever. That's why mine is colloidal silver based, and it has a whole bunch of herbals to help with breath as well as gum health too. Is natural fluoride in well water as neurotoxic as fluoride in tap water? It is. It is. It's all concerning. It's not the exact same. It's a different kind of form of it, but it's just as problematic to bones, to everything else. So somebody else earlier asked, what's the best water filter for the entire house to use? So you're going to have to use an RO filter to get rid of fluoride. That's the one I recommend. However, RO water can be very dangerous. It can actually lead to a lot of tooth decay because RO water has no minerals in it. So what I recommend is RO water with a remineralizer on any water you're going to drink or eat. So I have a remineralizer on my line that goes to my kitchen. Everything else can be reverse osmosis water. That's fine. But if you're going to eat it or drink it, you're going to need minerals back in it. My son has similar x-rays to the ones you posted with the wisdom teeth. How do you move the lower jaw forward using the expander? I don't want to take out the wisdom teeth. He's 15 and used Invisalign. So you are going to need to do some expansion at 15 years old. So probably a Vivos appliance to make more space here. And as the top jaw expands, actually the ones we use, they have a lower and an upper expander both. So you wear the upper expander during the daytime hours, you wear the lower expander during the nighttime hours, and it helps everything to move out. I grind my teeth and wear a guard at night. Oh, sorry, we got a dog in here. I grind my teeth and wear a guard at night. They want to crown the 8 front teeth. Would you suggest veneers? No. And here's why. Not yet. Veneers is the wrong first step. I did this. I was a cosmetic dentist for about 12 years. That's all I did was cosmetic dentistry. Loved it. I actually loved that. And I did this by mistake. I saw people who had ground off front teeth, and we just put a whole bunch of crowns or veneers in the way. What happened? They kept knocking those off. Why? Because no one has addressed the reason that you grind your teeth, that your teeth are worn. Most likely it's because you are not getting enough air at night. You've got to go there first. You've got to address that first. Otherwise, you're just going to knock those veneers off. You're going to do the exact same thing to those veneers that you did to your own teeth, unless you address the reason that they're that way. 3-year-old had a fall and trauma to her front two teeth. They're discolored. Pedodontist said that we would just watch for abscess symptoms. Thought on what I should do or supplements I can give. The answer is exactly right. You are going to watch for abscess symptoms, but there are some things you can do. So you can add vitamin D and K, and we have the liquid of that on our site. So you can use that with a kiddo. And I would do Mother Earth Labs. It's called humic and fulvic acid. It's also minerals. So those two things are going to get into the tooth internally to see if you can't regenerate some of what's happening there. But your 3-year-old may be losing those 2 front teeth. Darn it, a little early. Of course, they're going to be losing them eventually. So thank goodness they're baby teeth. Can DO and MO cavities be reversed? And have you heard of nano silver from Elementa? So DO and MO cavities, what does that mean? When the teeth are touching each other like this, in between cavities are going to be called DOs and MOs. Basically, it's our shorthand terminology that we use in the dental office. I have seen cavities there reverse. And how do I do it? So what we do is I have you brush with a tooth powder, and then I'm going to have you floss directly after. It's going to take some of that down into those spots. Then you're going to use the mouthwash, which is also going to take some hydroxyapatite into those spots. Along with that, you're going to do the vitamin D3, K2, and the tooth and bone formula on the inside. So minerals on the outside, minerals on the inside. And I've not seen them reverse. What actually happens is on an x-ray, you're still going to see it there. I've seen people who have the exact same looking lesion or cavity on an x-ray for 8 years standing. They never get bigger. So they're just arrested or stopped from progressing. And that's all we need them to do. They just need to stop. So you're going to get as many minerals in there as you can. The nano silver from Elementa is the same nano silver. It's actually the exact same nano silver that I use in my mouthwash as well. The reason, and I used to use Elementa, and actually Elementa is a phenomenal product. I love it. It just has limitations because it doesn't have any sort of mineral component, hydroxyapatite. It's not going to remineralize. It's going to kill bugs that are causing tooth decay. Absolutely. And it's great. The silver in it's fabulous, but it doesn't add the mineral back. So that's why I've added hydroxyapatite to my mouthwash, because I want to kill the bugs with the silver, but then I want to add the mineral back as well with the hydroxyapatite. Should an adult have their wisdom teeth pulled? Not if there's room and not if they're causing issues. Leave them alone. I tell people this all the time. Leave them alone. If there's room and they're not causing issues, leave them alone. I love using your tooth powder and mouthwash. Thank you. I'm so glad. What do you think about the gems glued on the teeth? Actually, I've had some people ask me about this just recently. So, gems glued on teeth. Could it be a problem? Is it an issue? If it's interfering with the bite, that could be a problem. But usually it's on a front tooth, so it's not going to interfere with bite as long as it doesn't damage the tooth underneath. And I'm not really familiar enough with what they're using to glue those on to give really an educated opinion. But that would be my concern, is simply what is it doing to the tooth underneath, and is the tooth able to stay clean? And if it's so, then I guess glue a gem on your tooth. Electric toothbrushes are regular. It's all about what you're going to use. Electric toothbrush absolutely will clean your teeth better, unless you're very, very meticulous in every single tooth. You're spending every single, usually we kind of get lazy. And so the electric toothbrush makes up for our laziness a little bit. What is the best thing we can do to arrest bleeding and gum bleeding and inflammation? My mom just had surgery and I want to prevent this from happening to me. Absolutely. So the mouthwash is phenomenal for this because it has silver that's going to help with gum problems. It also has calendula, which is going to help. As lavender, it's going to help. Marshmallow root, all the herbals in there are intentionally there for gums. But I actually, little secret here, have a gum mouthwash coming out very soon as well. That's even going to add an added benefit for it. So that, and then very good cleaning at home. I love Waterpik, and my favorite is the water flosser because it goes in your shower. It doesn't require any extra work to pull it out and make a mess in your bathroom or anything else. So I like the shower flosser. You're going to use that. You're going to clean everything very thoroughly in that mouth, and then you need to see the dentist frequently. That's actually this is one of the reasons that you need to see a dentist a lot, is if you have gum issues going on. We need to clean what's underneath the gum that you can't get to. What is all this talk I've seen lately about hydroxyapatite being toxic because it's nano, which crosses the blood-brain barrier? It's not just lately. This has been a while. So go onto my blog and you're going to see a whole blog article about this, about hydroxyapatite. Is it safe? So go check that out. I'm going to explain a lot. This explains why I use microhydroxyapatite, because it's small enough to get into the tooth, but not so small that it crosses the blood-brain barrier. So I'm very conscientious about that. And that's the reason I've chosen the one I have. Can I just use silica or diatomaceous earth? You can use that. However, hydroxyapatite is the actual mineral that the teeth are made of. So it's the thing that the teeth are missing if they're starting to get a cavity. So it is going to be more effective than silica or diatomaceous earth because it's the whole complex. Silica is part of the complex, but it's not the whole thing. Hydroxyapatite is the whole thing. It's what your teeth are made of. So it's replacing what they're missing. I have an infected root canal that now has an abscess with pus. They did an ozone injection. How much time can that buy me? None. There's no way you're going to be able to mitigate that infection with an ozone injection. It's like taking an antibiotic. Basically, it's going to give you 2 weeks, and then you're going to be back to where you're at again. So that tooth needs to come out. There's really no other option there. My mouth seems to become dry if I don't eat often, and then breath becomes bad. Mouthwash is phenomenal for that. And little tip, the breath spray is actually just the mouthwash in a spray bottle. It has marshmallow root, which keeps your mouth from getting dry. So just carry that breath spray with you, get one of the bottles, and then just refill it with your mouthwash. It's the same thing. And that's going to help with keeping your teeth healthy, your breath fresh, but also your mouth from getting dry. What would cause the inside of my mouth to feel irritated? I've used nystatin, no relief. Used chlorotrimazole, seemed to make it worse. Periodontist says it's not a yeast infection. I can't get relief from anything. All right, so this may be something we call burning mouth syndrome. Really annoying, and it's often a zinc deficiency. Zinc or vitamin B12 deficiency. So most likely you might have something called MTHFR. It's a genetic variant. I would recommend a premethylated vitamin B. My favorite is called Neurobiologics. And I think it's called Methylation Complete. I would start doing that, and I would start doing zinc lozenges and see if you can't reverse it. New here, new to holistic dentistry. Welcome. What would you suggest an adult and a toddler to start with? Toothpaste, mouthwash, toothbrush, etc. Absolutely tooth powder. You're going to just start with a version that you want to do, either the remineralization, the whitening, the sensitive, one of those, and then the kiddos for your toddler, that kid's kind. As long as you're using that, that's going to be your starting point. The next key is going to be your mouthwash, especially for you as an adult, less for your toddler. Really, they're not going to be able to use a mouthwash effectively. So tooth powder, that's where you're going to start. When is your toothpaste coming out? Not soon enough. Believe me, I am so on this. We actually have it being independently tested at a lab currently, and we have the remineralization formula done. We're now working on the whitening, the sensitive, the kids, and the gum formula. So it's coming. I would think probably the first of the year, though. None of these things happen fast, unfortunately. I am not a very good person at being patient, and I don't like this process, but it is what it is. But I'm working as hard and fast as we can. I was told to remove my wisdom teeth because the pockets around them are measuring 4s and 7s. I don't want to go through with this if not necessary. Okay, so what that's meaning is that basically it's hard to clean around them. So here's my tip and trick for cleaning around wisdom teeth. You're going to get woven floss or a piece of yarn, but woven floss works well as well. It kind of has this mesh of fibers. You're going to use it and you're going to drop that behind the wisdom tooth. And really, I want you to think about like a towel on your back when you're drying yourself off. You're going up, you're going down, you're going everywhere with that floss. You're going to go behind it. You're going to go up, down, everywhere. You're going to go in front. You're going to do the same, up, down, everywhere. The key is keeping it clean. If you can keep it clean and if it's not compromising the tooth in front, then it can stay there. All right. Thank you all. This is awesome. Your questions are so amazing. I love it all. We're a little bit past time here. We're going to keep doing this every single week, and I'll see if I can't hit some Q&A sessions in the middle of the week too. Make sure you're keeping up on the reels and on the stories. We share so much information there, and I'm going to start talking about a lot of other things besides just teeth as we start getting into the book and all the sell well topics and models and how to stay well. So thank you all for joining me. I love you and have a fabulous weekend.